So let's see what is hanging. Hanging is a form of asphyxia which is caused by suspension of body by a ligature encircling the neck, and the constricting force is the weight of the body. Now we will see the classification of hanging. Coming to classification of hanging, there are two types of classification. One is based on the position of the knot and the other is based on the suspension. Position of knot, it can be typical or it can be atypical. Typical hanging is, what do you mean by typical hanging? It means that the position of the knot is in occiput, and atypical hanging means not anywhere other than the occiput. Then based on suspension, it can be complete or partial. Partial is also known as incomplete hanging. In complete hanging, the whole body is suspended. In partial, the partial body part is suspended. Then in complete hanging, no body part touches the ground, but in partial, the body part is touching the ground because only partial body is suspended, for example leg, knee, etc. Then in complete hanging, the constricting force is whole weight of the body, and in partial hanging, the constricting force is partial weight of the body, and it is faster death in case of complete hanging, and it is slower death which is almost suicidal in case of partial hanging. Now this is all about the classification of hanging. Then coming to the causes of the death. Causes of the death, we will see how the compression forces are acting in case of this asphyxia. So here we have trachea, then we have jugular vein, carotid artery, vagus nerve, and the vertebra. Trachea, the weight required for the compression is 15 kg, and what is the cause of death here? It is asphyxia. In jugular vein, it is 2 kg, more superficial, and compression, cerebral venous congestion or apoplexy. In carotid artery, it is 5 kg, cerebral anemia. In vagus nerve, it is vagal inhibition of the heart, and in vertebra, it is 30 kg, and the cause of death here is cervical vertebral fracture. Now this asphyxia and cerebral venous congestion are the most common cause of death by hanging, and in cervical vertebral fracture, most common is the judicial hanging, and it leads to instant death. Now let's see about something about the ligature, because it occurs due to ligature. So what is ligature? Ligature is actually any available material that can be used as sari, rope, or dupatta. Now ligature mark is actually a pressure or patterned abrasion due to the ligature. Initially it is pale, but then it is parchment like, but eventually it turns dark brown. Now let's see what are the factors. First we will see about the ligature material. Ligature material can be thin or narrow, that is called cheese cutter method, which is narrow, deep mark, and can pierce the tissue, and it can be broad or soft, which may be faint or superficial mark. Then knot. The knot is fixed or it is slip knot. Fixed knot means fixed nose, incomplete or oblique ligature mark, and running nose is complete transverse mark. Now we will see the autopsy finding. Autopsy finding, we have some external findings and we have some internal findings. In external findings, we will see what are those. One is hypostasis, that is glove and stocking pattern. Glove and stocking pattern indicates that the body was in vertical position. It does not imply hanging. Don't say that. It doesn't say the cause of the death. It only indicates that the body was in the hanging position, in the vertical position. Then what are the changes we see in the face? In face, we will see what is the appearance. Appearance is, it can be congested or it can be pale. Congested is due to the venous occlusion, which occurs in case of partial hanging, and pale is due to arterial plus venous both congestion. It occurs in the complete hanging. Second is dribbling of saliva. Dribbling of saliva is the surest sign of the antemortem hanging. Now what happens in here? The ligature puts pressure on the salivary gland and leads to stimulation, and which increases the salivation towards the dependent position. Third is the protrusion of the tongue. It is the sign of antemortem hanging. Why? Due to lifting of the pharyngeal skeleton. Now next is la facies sympathicae. Now this is a sign of antemortem hanging. Now what happens is the pressure on the cervical sympathetic chain that leads to stimulation, and that leads to ipsilateral opening of eyes plus ipsilateral pupillary dilation, that is unequal pupils. You can see this emoji. It actually represents this la facies sympathicae. So this is about the face. Now coming to the neck. In neck we can see the visible ligature mark. It can be oblique, above thyroid in 85% of cases, and it is incomplete with a suspension peak. Okay, peak, which may be inverted V or a triangle shape, and differentiate between the hanging and the strangulation. Next is transverse ligature mark. In some cases we see this transverse ligature mark, which is the low point of the suspension, and slip. It occurs due to slip knot with running nose. So these are all the external findings. Let's come to the internal findings. Internal findings, we can see four things. One is thyroid cartilage fracture, next is hyoid bone fracture, third is vertebral injuries, and the fourth is carotid artery injury. What occurs in thyroid cartilage fracture? The greater cornu is majorly affected. In hyoid bone fracture, it occurs in 15 to 20% of cases, and the age is usually more than 40 years of age. And because more than 40, in less than 40 years of age, the hyoid is a cartilage, and after 40 years it calcifies and becomes bony, and due to some pressure it breaks. Now it can be abduction fracture, or it can be side to side compression fracture. Abduction fracture is anterior posterior compression. Both the ends are fractured and displaced outwards, and side to side means one end is displaced outward and the other is inward. We can see that inward compression is usually seen in case of throttling, and outward compression in case of hanging. Next we can see vertebral injuries. Vertebral injuries is otherwise known as, or we can say, judicial hanging. That is a type of vertebral injury, type of findings can be seen. Now this vertebral injury is due to the hanging with a long drop, that is increased force to the neck. So judicial hanging from a tree or balcony, these are some examples. It's also known as hangman's fracture, and the C2, C3, C4 fracture occurs, but C1 at least never occurred. C2 axis is most common. Then spondylolisthesis of C2 over C3 can be seen. Here we can see something called Simon's hemorrhage. What is that? Due to this prolonged suspension, bleeding behind the anterior longitudinal ligament occurs, that is strip-like hemorrhage in the intervertebral disc between the lumbar vertebra. Coming to the carotid artery injury, due to hanging with a long drop, for example, in case of judicial hanging, amusette sign can be seen. Now transverse, that is a transverse intimal tear. Now this is associated areas of bruising in an antemortem sign. Next we will see about the manner of death. Manner of death, it can be suicidal, homicidal, or accidental. In case of suicidal, this is the most common method of suicide, hanging. After this, second most common is poisoning. Now the fatal period is 3 to 5 minutes, and most common. Why? Because this is a painless method of death. Then homicidal is judicial hanging, which is practiced in India. Hangman's knot. Now ideally this hangman's knot is submental, but in India it is below the ear, and or we can say below the angle of mandible. There is a term called lynching or extrajudicial hanging. What does it means? That means that hanging by a group of people in the public. Now the third one is accidental. Accidental is otherwise known as autoerotic or sexual asphyxia, which is called hypoxiphilia or asphyxiophilia or coxvarism. Now this, what is this? The mechanism: asphyxia, which leads to sexual gratification. Now this is most commonly seen in the male perverts. What's the mechanism? There is partial neck compression, which leads to carotid compression, which leads to cerebral ischemia. Now that leads to the erotic hallucination, which leads to orgasm. Now if the release of compression occurs, then they will become normal. But if the failure to release pressure occurs, that will lead to death. So it is a form of masochism, that is pleasure in the sexual pain in, means we can say pleasure in pain. Now other signs at the scene of crime is transvestism, which is noted. We can see naked body, pornographic material, no suicide note will be found. So this is all about an overview of hanging. We have covered all the necessary topics for this hanging. Next we will see what is strangulation.